Hello, we meet again with me, Miss Kinan, in Maternity Nursing 2 in topic of reproductive system disorders in women with sexually transmitted disease or STDs. Our objectives are to talk about HIV/AIDS, genital herpes, human papillomavirus or genital warts, gonorrhea, syphilis, chlamydia, and nursing care for women with STDs. So we are going to start with HIV. As you can see, these are the virus of HIV. And HIV means human immunodeficiency virus. So that's the virus that causes the body to not having immune system, and it's isolated in the blood, semen, vaginal secretion, urine, saliva, tears, cerebrospinal fluid, amniotic fluid, and even breast milk. And the virus can be transmitted through intimate contact with infected bodily secretions, exposure to infected blood and blood products, and run perinatal transmission from mother to infant. And HIV testing is very important in every pregnant woman to avoid transmission to the baby. The test can be done is antibody test, antigen antibody test, and even nucleic acid test or NAT. HIV testing needs to be done if there's another infection such as herpes virus or candidiasis that's occurred to the mother or to the woman. And pregnant women needs to provide consent for HIV testing and have the rights to opt out from the testing. So basically they need to say yes to be tested or say no if they don't want to be tested. And until now, there is no medication for HIV or AIDS, but then the untreated HIV can become AIDS with opportunistic infection. So currently, the drugs that we are using are to interrupt the productions of the virus, which we call antiretroviral therapy or ART. The nursing consideration is to teach the signs and symptoms that require medical attention to the woman, to explain the diagnostic and screening tests and follow-up testing needed for some infections, and to teach the preventative measures and follow-up to ensure a cure for the non-HIV infections. And we can also identify STD prevention measures that compatible with age, language, male-female relationship in women's culture, values for the women's well-being, frequency of intercourse, number of partners, and other factors that may be identified through the woman who seeks care. So once we have a woman who seeks care for STD, we can then counsel them for what are the preventive measures that she can apply in her life so she will not get STD. And then after the woman seeks care, we can refer the woman to the support groups. If she has HIV, it means we refer her to the HIV specialist or even to the follow-up and treatment options if she is looking for care with her from her infection. Next, we're talking about genital herpes. So this is genital herpes. Genital herpes is caused by a virus as well called the herpes simplex virus or HSV. And there are two types of HSV, HSV type 1, which cause oropharyngeal infection. And when the person has HSV1, it means the body produces antibody against the HSV2 infection, so make the infections of HSV2 is not very severe. And then the type 2 or HSV2 is the genital lesion, where the infected person probably does not have HSV1 virus, so they have no antibodies of HSV1. And then the transmissions of genital herpes happen through direct contact with the infected person. Within 2 to 12 days, there will be the primary infection session, where the vesicles or the blisters will appear with the characteristic of cluster of the blister on the vulva, perineum, or perianal areas, and this initial lesion may cause severe vulvar pain and also tenderness, as well as dyspareunia, which means that as painful intercourse, and also the lesion can be inside the cervix or inside the vagina. Women will experience flu-like symptoms, including fever, general malaise, and enlarged lymph nodes, and the vesicles will rupture in 1 to 7 days, and it will form ulcers that will take 7 to 10 days to heal. In genital herpes, when the symptom abate, remember that the virus remains dormant in the nerve ganglia and periodically can reactivate itself. And in particular, when the women have stress, fever, or menses, then these recurrent episodes are not so extensive and painful as the initial episodes, but still very contagious. And the diagnosis for herpes is made based on clinical signs and symptoms, and it's confirmed by the viral culture of the fluid inside the vesicle or inside the blister. There are currently no cure for this disease, but there are antiviral drugs to reduce or suppress the symptoms, shedding, and recurrent episodes of herpes. Such as the antiviral, such as acyclovir, Zovirax, famciclovir, or even valacyclovir or Valtrex. And for sure, the woman should be abstain from sexual contact while they are still lesion to avoid transmission to partner. And in initial infection, still needs to remain abstain from sexual um, contact until the culture is negative. So the genital herpes for the nursing considerations will be to clean the wound twice a day with normal saline, to do comfort measures for the area, such as with a warm sitz bath with baking soda, and even drying with cool hair dryer and patting the area with dry towel, as well as taking the oral analgesics such as aspirin, acetaminophen, or ibuprofen, and also provide counseling and education regarding etiology, signs and symptoms, transmissions, and treatment. So these are the pictures of genital herpes. You can see that it's a cluster of blisters that is so typical herpes. And next is the human papillomavirus. So this is caused by the virus human papilloma virus and causes a condition called condylomata acuminata or venereal or genital warts. And the warts are dry. It's like wart-like growth that's small and discrete, or they may be in cluster and resemble cauliflower. The common sites for these are in the vagina, labia, cervix, and perineal area. So the condylomata acuminata associates with HPV and cervical cancer, and until today there is the HPV immunization and cervical cancer immunizations available for women to take. And the patients, once develop signs and symptoms, are going to be examined using a colposcope in colposcopy to evaluate whether there is abnormal tissue development and to identify the HPV. So women with condylomata acuminata should perform more pap smear tests to detect cervical dysplasia or abnormal tissue development within the cervix or within the vagina. The goal of the treatment is actually to remove the warts and can easily transmit HPV back and forth between sexual partners. So the treatment is determined by the site and the extent of the warts and also the preference of the women. The treatment can be by topical treatment, such as for the filling, trichloroacetic acid and bichloroacetic acid to treat the warts. But also, if the treatment of the wart is not responding by the topical treatment, so we can go with a cryotherapy using extreme cold and laser vaporization and LEEP or conization. And we can also do a therapy using interferon or antineoplastic drugs, which are used when the conventional therapy are not even responsive anymore to the patients. So the treatment did not actually eradicate the virus, and actually recurrent may happen, and all sexual partners need to be treated. Then no sexual contact and the use of condom is very recommended to reduce transmission. Next one is gonorrhea, this one. So gonorrhea is a disease of sexually transmitted that caused by the bacteria Gonococcus neisseria gonorrhea, and this causes infection of the genitourinary tracts. And some women have this asymptomatic, but some symptoms do occur, such as purulent discharge, dysuria, or even painful urinations, and also dyspareunia, which means a painful and sexual activity. And the diagnosis is based on the positive culture for gonococcus, and the gonorrhea is actually associated with a pelvic inflammatory disease, which increase the risk of tubal scarring and can result in infertility or ectopic pregnancy, as in chlamydia infection. So actually, gonorrhea and chlamydia they often exist together. So the dual treatment between gonorrhea and chlamydia needs to be done as a routine, and additional drugs to add the treatment of chlamydia. For gonorrhea, we use cefixime, ceftriaxone, and ciprofloxacin, and all sexual partner also needs to be treated simultaneously, and there should not be any intercourse, and the man should use a condom to cure um, until the cure is established. The next one is syphilis. So syphilis is this one. Syphilis is an STD which caused by the spirochete treponema pallidum, and it's divided into three stages: the primary, secondary, and tertiary stages. The primary syphilis is the painless canker that develops on genitalia, anus, or lips, or any oral cavity. And at the time diagnosis is made by the dark field microscopic material scraped from the base of the canker, where the serologic test result generally negative in this stage. But if the untreated canker is healed within 6 weeks, the disease is very contagious and infectious at primary stage. Although the chancery probably disappear, the spirochete lives and it's carried by the blood to all parts of the body. So after 2 months after the initial infections, the infected people will exhibit symptoms such as secondary syphilis, including enlargement of the spleen and liver, headache, anorexia, and generalized maculopapular skin rash, with skin eruptions called condylomata lata, which may develop on the vulva during this time. Condylomata lata resemble warts. They contain numbers of spirochetes and are highly contagious. Serology test results are generally positive at this time. And if untreated, the disease will enter the latent phase, which might last for several years. In tertiary syphilis, the following latent phase may include the heart, blood vessels, and central nervous system. So the general paralysis and psychosis may result. Another thing about syphilis, that in order to identification of the spirochete in material scraped from the canker, The diagnosis also needs to be made by serology. The usual screening test, called VDRL, is the Venereal Disease Research Laboratory Serum Test, which based on the presence of antibody produced in the response to the infection. The rapid plasma reagin, or RPR, and the fluorescent treponema antibody absorption are the most specific and often to be done to confirm the positive VDRL test. The best treatment of all stages of syphilis is with the parenteral penicillin G, and the women who are allergic to penicillin can be admitted to the hospital for desensitization to penicillin, then follow the administrations of the drugs. The last one is what we call chlamydia. So chlamydia is also infections of STD caused by bacteria, and it's most common in Western country. The incidence is particularly high in sexually active teens and young adults, and it's actually asymptomatic in women, which makes the disease hard to diagnose and control. But it should be suspected if the male is being treated for a non-gonococcal urethritis. It means, and the test for gonorrhea is negative, then the women needs to have the symptoms, which are the yellowish vaginal discharge and painful urinations. At the same time, when gonorrhea exists, chlamydia infections also exist, so we treat both of them at the same time. The diagnosis of chlamydia infections can be made by isolating the bacterium in tissue culture by enzyme-linked immunosorbent assay, ELISA test, or by direct fluorescent monoclonal antibody. The tissue cultures of the organism is most accurate but it requires more times, and if chlamydia is untreated, this can ascend from the cervix to the fallopian tubes, and also will be the one chief causes of the tubal scarring, which will cause a pelvic inflammatory disease, infertility, or ectopic pregnancy. In chlamydia, the treatment usually eradicates both chlamydia and gonorrhea because too often coexist, and using the drugs such as azithromycin, doxycycline, ofofloxacin, levofloxacin, and erythromycin. The treatment of all sexual partners is essential to prevent recurrent and further spread, and use of condom until the cure is pronounced is really essential as well. Now, as a nurse, how we take care of the woman with STD? The first one, we have to understand that there are most common STD in women, which are caused by the bacteria such as chlamydia, gonorrhea, and syphilis, and caused by the virus such as HIV/AIDS, genital herpes, and human papillomavirus. So once this happens, nurses can provide counseling and educations on preventions of sexually transmitted disease by complete abstaining from sexual activity, use barrier methods such as condom and female condom, and the preventions of STD is the most effective way because some STDs have serious potential lethal effects and incurable. Then preventions is something that is very critical to be done before STD happen. We can assess the sexual history on 6Ps, such as partners, how many partners, prevention on pregnancy, what you do to prevent pregnancy, protections, what type of protection you're using, practices, what type of sexual activity you're doing, and the past history. And we can provide the counseling with open-ended questions using understandable language and assuring that the treatment will be provided. We have to also remind the women that acquiring HTD will have a serious consequences for the woman, and she is at risk for infection. Nursing diagnosis that can happen is risk for infection, anxiety, fear, risk for chronic self-esteem, and readiness for enhanced health literacy. Takeaways for today's, we know that there are two types of STD caused by bacteria and virus. In chlamydia is caused by bacteria of Chlamydia trachomatis asymptomatic. There should be yellow vaginal discharge with painful urination. Medication can use azithromycin, doxycycline, ofloxacin, levofloxacin, and erythromycin. And gonorrhea is caused by the bacteria Gonococcus niger gonorrhoeae, can have a purulent discharge, dysuria, and painful urination, and dyspareunia. Can be treated using cefixime, ceftriaxone, and ciprofloxacin. In syphilis, it's also caused by bacteria, spirochete, Treponema pallidum, and will have what we call condylomata lata that resemble warts and will be treated with parenteral penicillin G. For HIV/AIDS, we know that the human immunodeficiency virus is the cause. There is no medication for HIV, and if it's untreated, become AIDS with opportunistic infection. The drugs regimen to interrupt the production of the virus is antiretroviral therapy. And then with genital herpes or caused by herpes simplex virus, there is HSV1 for oropharyngeal infections and HSV2 for genital lesions. There are no cure about this, but they are antiviral to suppress symptoms such as acyclovir, famciclovir, and valacyclovir. The last one is human papillomavirus or genital warts. The human papillomavirus is the one that causes condylomata acuminata or venereal or genital warts. And there are immunizations for SPV and cancer and cervical cancer available. Meanwhile, we can also treat it with topical treatments such as fodofilin, trichloroacid acetic acid or bichloroacetic acid. And then we can also use interferon and antineoplastic drugs if this conventional therapy is not working out for the genital warts. So that are all what we learned. May you have a happy learning journey.